HIV testing is free, easy, and confidential. I am Syed Sarmadali, and you're watching MedScenarios. Today, we are gonna talk about HIV testing services. So, the contents here are principles of HIV testing services, HIV testing services protocol, and targeted HIV testing services. So, now we are talking about the principles of HIV testing services. So here it is. Here there is the principles of 5 C's. Suppose a person has come to you and he wants to get tested for HIV testing. So here we are going to get the confidentiality first. Like, see, you have to first gain the trust of the person that this conversation which it will be between us, and no one will get to know about the thing except us, right? So this thing is confidentiality, and then after you have gained the trust of the person, now you have to move on to the consent. This consent here, like you have, like there are two age groups. People who are younger than 12 years, the people who are younger than 12 years, they will get the guardian or the parent of that person will get notified, will get consent, right? And then for the people who are above 12 years and 12 years and above, they will get the self consent, right? Because they maybe, like, okay, they are mature enough to get consent. And then there is another thing, and you can say another thing, that 15 years and above, people who are 15 years and above, their partner should be notified. If there is the sexual partner, they should be get notified via assisted partner notification. Then after this, after getting the consent and this confidentiality, we will move on to the counseling. So you have to provide pre-test counseling and post-test counseling. Pre-test counseling and post-test counseling. This pre-test counseling should consist of the risk assessments, and you have to listen to the client, and you just answer the person very easily. Tell them about how the virus is transmitted, what are the risk factors, and why she or he should test it for HIV. Then for the post-test counseling, you also tell them about how the HIV is like what are the preventive measures, what are the benefits of getting treated for HIV, and like the impact on their life also. So after that, like this counseling, uh, after pre-test counseling, we will move on to the correct test results. See, these HIV test results should follow the HIV testing protocol and the SOPs for HIV testing. People should get the correct results because it's very important for their treatment and for the rest of their life. So, like, there are the chances for false positive and false negative results, but they are very little. And for the self-testing kits, for these self-testing kits, you like there should be very clear images on those kits, indicating that how to use the kit accurately, and how like this will lead to the accurate results, right? Obviously. So for the connection to care, the last one, if the person's result is negative, you just tell them about the preventive measures and how to prevent the HIV transmission. And then for, if the person is HIV positive, then you have to link them to the care, the treatment plan, and so they will be linked to the ARD. And it should be within the 7 days if it is the same facility, right? If it is in the same, within that same facility. And it should be within the 14 days if the person is referred to another facility. Okay. So moving on to the other slide is the HIV testing services protocol. Okay. For this HIV testing services protocol, there is demand creation first. See, you in the market, in this environment, in the market, you have to create the demand for HIV testing. Why it is important, why the person should get tested for HIV, what are the benefits of it, and how this will lead their life to certainty, right? So this thing is like you have to address the behavioral and structural barriers like the mainstream media, social media, and the interpersonal communication, some seminars about it. And then you so it will influence the people, right? If it will influence the people, it will change their perception, it will change the social norms. So then after that, we will see about the pre-test information and counseling. So this pre-test information and counseling, it helps the client or the patient to know the benefits of HIV testing, ways the HIV is transmitted, and assessment for client risks, right? So it also leads to, right, the basic HIV preventive measures. And please allow the clients to ask the questions and give very appropriate answers to their questions. Then, after that, we will go for the HIV testing. See, if the if the person is below 18 months, he or she should be tested via DNA PCR test. And then if the person is above 18 months, then like this antibody or antigen antibody test, they are very excellent for them. If they have reached the window period like for 90 days or something like that. So because this algorithm, it is different for age groups, as we have discussed before. So for the post test counseling, you assess the readiness of the client, and just don't give them the shock first, right? So assess the readiness of the client, make them very calm and easy, and then give the results as it is they are, right? So after that, if you just check for their concerns and let them ask the questions, and you encourage the disclosure, like encourage them, if they want to disclose them, if they want to disclose it to their client, to their partners, right? So after that, this thing like this post test counseling, for it's again like that, the counseling, the rule is same for the people who are younger than 12 years. They should be their parent or their guardian should be counseled about it, right? And if they are above 12 years and above, they are mature enough to get to know, like what to do. And yeah, if the person is mentally retarded and he or she, they are not able to you know uh, decide what is beneficial in their behalf, so the parent or the guardian can be counseled, right, about it. So after that, there is the linkage, as we discussed before in the first slide of that, that this linkage, you have to link them to appropriate HIV prevention if it is negative, right? And if they are positive, then link them to the ART treatment, the HIV treatment, so they will they will get very healthy life and they will not be exposed to the other diseases, right? So moving to the next slide, there is the HTS protocol. So it is, see, it is almost the same as we discussed before in the two previous slides. So there is the demand creation. You you create the demand, and it as we discussed before, how you will create the demand, it is in the previous slides. Then it will lead to the HTS eligibility and pre-test counseling for all the clients, right? And these, see, there are two type of clients, which are like which are initiated by the service provider, right? Which are like the hospital or the doctor or something like that, or which, or the other one are the which are the self-directed, right? With the self-referred. So they want to get tested by, like they are the referral itself, right? So the individual, couple, or group counseling, you give the information, and then there are the clients who want to get tested, right? And then there are the clients who don't want to get tested. So people who don't want to get tested, they should go for, like they should be counseled and encouraged for testing. And the people who want to decide to test, the consent is obtained, they are tested. If they are positive, they are linked to the HIV treatment services. If they are negative, they are linked, like you tell them about the prevention services and all that about that. So if the results are positive, you have linked them to the support services, the treatment services, etc. Next, moving on to the next slide, there is HIV testing services eligibility screening. So see, the the screening is very necessary, like you just don't provide testing for everyone, in the population. You just have to make some grouping, like who should be screened for HIV testing, who should not be screened for HIV testing. I'm talking about the screening, not the testing. So for the screening, um, people who should be screened for the HIV testing are the adults and the children who are in the OPD community, male clients who are who are volunteered for safe male circumcision, and then the patients who are in the wards due to trauma, and the partners of the pregnant breastfeeding women. Then there is a group who should the people who should not be screened, like maybe they would be having that, right, or they are at the risk of getting HIV. So they are the presumed or the diagnosed TB clients. Then the malnourished individuals, see, for these malnourished individuals, they are sometimes they are infectious, right, like they are having the infection, but but there maybe there are no symptoms because of they are malnourished, right. And then the specific symptoms, you can say. And then in patients, clients with current STIs, if the person is having the STI, sexually transmitted infections or sexually transmitted disease, another name. So maybe there is a probability they will be having the HIV, or the HIV could also be transmitted. Maybe not, maybe yes, right. So the pregnant and the breastfeeding women. uh, then for the sexual offenders and survivors, and then the blood donors and the blood tissue and organ donors. It is very important because they should be tested. These blood donors, they should be tested before giving the blood, because if there is the HIV in their blood and it is not diagnosed, and the blood is given to the person who is HIV negative, see, this will create somehow the hazard, something like that. So the person will get HIV positive just by doing nothing, right. So next slide is targeted HIV testing. Okay, targeted HIV testing, what is it? You are targeting a group of individual or population who are at high risk of getting HIV. This is the targeted HIV testing. So why are we doing this? Because it is very difficult to diagnose the people who are living with HIV in the general population. Okay, moving to the next slide. What are the risk factors? Risk factors, because everyone is not there. Why are we targeting? Like, what are the risk factors? What are the basis on which we are targeting those population, those individuals? These are like the person is having the multiple concurrent partners. Okay, a client who is in the discordant relationship, right? And then there is a person who is not knowing his partner or her partner status. Another thing is that the person is a biological child to an HIV positive person. Okay, and then there is another thing that the person is the sexual contact of an index client. So what is an index client? Index client is like, like the person has just come for the first time for the HIV testing, and he diagnosed for HIV positive status for the first time testing, so it is the index client. Then there is like the person is belonging to a key population, or he or she, they are living in that population where there is a lot of HIV. Okay, so what are the benefits of HIV testing services, the targeted HIV testing services? See, the person, like there it will be the early identification for of HIV, right, in the population where there is high incidence. Then the health professionals, they will focus on that population, not on all of them, just that small group, and it will be much better. Then it will also reduce the workload on the HIV, on the health individual, like the person who are providing the health workforce. And then there will be a higher positivity rate for testing. See, like the people who are on the risk factors, people who are having the risk factors, who are at high risk of getting the HIV, they will yield the higher positivity rate because they are already at high risk. So the resources, the testing resources, they will be maximized. Okay. And why it will be maximized? Because you are, you are targeted, you are targeting the specific individuals. Then what are the forms of targeted HIV testing services? Right now, there is like screening for HIV testing, as we screen like which are at the high risk, which are not at the high risk. Then after that, the index client testing. The person has come for the first time, got positive result for the HIV testing. Then the for the assisted partner notification, people who are 15 years and above got positive for HIV. There, and they are having the partner, right? They are having their sexual partner, so their sexual partners should be informed via assisted partner notifications, so that they should come get tested and get their HIV status to be known, right? And then there is know your child status. There's something like, you can say, some campaign or something like that. The biological child of the see, if the mother is negative, the and the father is negative, the child will be negative, right? But if the mother is positive or the father is positive, then they are at the higher risk, and they are in the that population who, on which we are focusing, on which we are targeting. So it is for that know your child status, that by that. And then there is social network strategy, and then HIV self-testing kits. See, for this thing is HIV self-testing kits, like they are available for that oral use, something like that. Also there is some finger prick also for that thing. And then for oral use, it is for the via saliva. So it is some like it is very good, it is very confidential. And if they are used very accurately, they will give the results, very accurate results, and they will not false positive or false negative type of things. But everyone doesn't know how to use that kit. So like I'm again saying that there should be very detailed graphic images, or and there should be detailed description on how to use it. And that's the thing. So these people can be tested via HIV self-testing kits also. So we are ending here. So the HIV, get like this diagnosis and treatment of HIV leads to a healthy and long life. Thank you so much.